Welcome to the forum at the Harvard School of Public Health. We're here today for a panel on the Cost of Inaction initiative. Before we begin, the School of Public Health's Dean, Julio Frank, would like to say a few words.
In the aftermath of the senseless bombing yesterday at the Boston Marathon, and on behalf of my fellow panelists and the entire Harvard School of Public Health community, I wanted to take a moment at the beginning of today's event to extend our deepest sympathy to the victims of yesterday's violence at the marathon. We are all saddened by this senseless act, which took place just a few blocks away from our school. I know today's panelists join me with heavy hearts in thinking of everyone whose lives have been forever changed by this horrible event. Time like this call us all to pull closer, to support one another and work for peace and goodwill, not only in Boston, but throughout the global community who join in solidarity with Boston today. I thank everyone who has chosen to join us, both in our studio and online, despite yesterday's tragic events, and look forward to a fruitful discussion about the cost of inaction. Thank you. Sam?
So I'm going to be the moderator today. My name's Sam Lowenberg, and I'm a journalist. I was a Nieman Fellow in Global Health Reporting at Harvard last year, and now am the lead reporter on a special project on child mortality for GlobalPost, which is partnering on this, this event. And I'll introduce our panelists. Next to me we have Albina Dubois-Douvray, the founder of the FXB International. We have Timothy Tahane, the Minister of Energy, Water Affairs, and Meteorology, and former Minister of Finance and Development Planning for Lesotho. We have Professor Sudhir Anand, Professor of Economics from University of Oxford. And we have Dean Julio Frank of the Harvard School of Public Health. And I'm just going to briefly explain what the cost of why we're here today, what this cost of inaction initiative is, and what we're going to be talking about. And basically it's a research and policy initiative that brings a new approach to addressing the ill health, poverty, and despair that affects millions of children around the world. Just to put that into context, give you some brief statistics. Around the world, there's more than 800 million people are malnourished. Many of them are children. Pneumonia and diarrhea cause more than 2 million deaths a year, child deaths a year. And overall, more than 7 million children under the age of 5 die every year. Most of that is due to preventable causes. And preventable causes is what the cost of inaction really is getting at. The formal definition is that it enumerates and quantifies the social and economic costs of failure to perform a specific action which is known to have a positive impact. So what that means is, if you know how to address a problem and you don't do it, what's the impact? What's the cost? What is lost by not doing what you know how to do? This concept, this approach, has become a book, which I have here, well thumbed through. And it's The Cost of Inaction, Case Studies from Rwanda and Angola. And it was published by the François-Xavier Bagnoud Center for Health and Human Rights at Harvard. And what it does is it uses case studies of vulnerable children in Rwanda and Angola affected by poverty and ill health, and then looks at specific interventions that were applied to address the biggest problems facing them, and did this as a way to show in a comparative format not only what could be done, but the impact of what happens when nothing is done, and to sort of and to really demonstrate that. But to give us some background on this, and to give us their own take on the cost of inaction, and we'll have each of the panelists kind of briefly address address this issue. So maybe we could start with you. If can you tell us why did you come up with this approach? What was the genesis, and what are you hoping it will happen?
Well, I have to start with the fact that FXB International of 24 years ago started because it was named after my son, François-Xavier Bagnoud, who died. And he was a very committed helicopter rescue pilot. So the mission of FXB International is to rescue AIDS orphans and children living in extreme deep poverty, to be able to raise them properly, and to avoid that they fall into all the ills that we know, the prostitution, the criminality, the child soldiers, the drug dealing, etc., and to raise them so that they can become productive and contributing citizens in the future. So I then also founded 23 years ago the FXB Center here at Harvard for Health and Human Rights to give them an umbrella of protection, of research, of advocacy, and of policy influence. And in that format, I was seeking to get a study done by the center on this terrible thing that I was seeing in my work with the program that I made for those children, which is the FXB Village model, in which, well, it's long to explain, but if you go online, you'll find it. So to prove that there are more than the children we were taking care of, like Sam just mentioned, there's at least 100 million around the world, if it's not 1 billion and over. So I was looking for a study that would prove with very solid economic evidence that it was going to be more expensive for governments to repair the damage downstream to those children or to reintegrate them into society, rather than to invest properly in their good raising with access to everything they need, basically their human rights, by a family, and to therefore invest upstream. So, of course, I talked to the various economists, and those economists told me the figures, and it was all around the world, it was too complicated, there wasn't enough data, and Professor Amartya Sen and Professor Sudhir Anand found the idea interesting. So the FXB Center and them started to put together this study, and Professor Sudhir Anand did the study from A to Z. And he the clever thing is that they limited it to a segment of this discarded generation of hundreds of millions. And they took the children affected by AIDS and in 2 African countries. And they also, which is very important, I think, devised this chapter 2, which is a methodology of how one can calculate the cost of not acting, the cost of inaction. So that was how I came about to push this study to happen. That was how it happened, because they intentionally understood it was urgently needed to explain to governments what the big problem was.
Thank you. Mr. Tahani, as a government official, how do you how does this cost of inaction, how does it affect your thinking and your work?
So sometimes in public policies, you have to make decisions, and decisions sometimes on incomplete information, but they have to be made. And the concept of the cost of inaction, perhaps in some ways we try to think of it in making decisions, especially in finance, because there are limited resources and you have to make a cut-off somewhere. And then the question becomes, what do you cut off? You can use the opportunity cost analysis and benefit cost analysis that economists use, but sometimes you cannot quantify all that you forego by making a particular decision. So practically, I will make 3 points. If you look at children or population in Africa, it's a young population, and a large number of those is children, whether they are between 14 and 24, or you start from 1 to 5. And so the question becomes, can you have viable societies in Africa that are capable of innovation, capable of good life and everything else, if you don't invest in those children? And it is in that frame of mind that this analysis and the concept becomes very helpful to policymakers. Let me take from which are the examples in the book are many, but if you take HIV and AIDS, the direct effects of giving that child the antiretrovirals, and you see that child becoming better and living a normal life, and therefore contributing to society. You have the direct, the indirect, subsequent consequential effects. Then you take the mother. If the life of that mother or father can be extended through the use of antiretrovirals or whatever it means, then they will be able to bring up their children, and society benefits. So the cost of inaction would probably be not providing the antiretrovirals, or just letting those children and saying it's too expensive, or if they have to go to second line drugs, you say it's too expensive. But it's too expensive for what? I think that's why I would like to leave it, and in the discussions we can elaborate. Thanks, Sam.
Great, thank you. Professor Anand, this approach is not perhaps a traditional economic approach. You've taken a sort of a wider scope here. Can you talk about that?
About that specific thing?
Yeah, or if, yeah, as you
okay. Well, the cost of inaction is not the cost of doing nothing. It's the cost of not doing some particular thing, because there are certain negative events that you can't avoid by any action. For example, a tsunami or a volcano erupting or something. So where one observes negative consequences, as both the previous panelists have pointed out, in the case of addressing problems that confront children, and in this book we examined, to begin with, problems that affect children who are in extreme poverty and or also are exposed to HIV/AIDS through their parents or through the community. So are there actions that can be taken to avoid the negative consequences? And if so, then in evaluating those actions, we must take account of the negative consequences that have been avoided, which would otherwise constitute costs to the society, to the individuals concerned, to the economy, to the community, and so on. So the idea here is not simply to appraise an intervention, be it a health intervention, in terms of the constitutive health benefits, such as reducing ill health or infant mortality or sickness, but also the consequential benefits that if a child is not ill, he or she is likely to do better at school, to attend school first of all, and then to learn better, and so on. And these are quantified in through the use of some of the studies that have been done in different contexts in the development economics literature. So, so one aspect is the taking account of actions in one area or sector, their consequences in another area. The second is, as the minister was saying, children. You see, if you don't act early in terms of children's, say, early childhood development, then the costs can be quite large, and they may be irreversible. For example, if children are stunted, that's a condition that's rather difficult to reverse. If children's neural networks don't form, then that leads to serious consequences, again, difficult or impossible to reverse. So the costs of inaction will be large if there's serious harm from inaction. If the harm lasts over a long period of time, as it would in the case of children who have, generally speaking, expected to have longer life than, say, an adult, and say the costs rise over time and possibly even are irreversible. And in some cases, clearly they are irreversible. And for example, if a child dies, that's the ultimate irreversible consequence.
Thank you. Dean Frank?
Well, first of all, I think the whole concept of the cost of inaction is a brilliant insight, because we're used, especially when we're setting priorities, to estimating the comparative costs of different courses of action. And that sort of limits the repertoire of our priority setting exercises. But this idea of looking at the fact that failure to act is in itself a decision, right? Entails a decision. And then enriching the repertoire of priority setting to include in a formal way the cost of that failure to act. I think it's a brilliant insight, and I think Sudhir Anand and the entire his collaborators in this book are really to be commended for what I think is a very, very insightful exercise. I mean, at least I have to say that reading the book made me really think a lot. As Amartya Sen says in his foreword, it casts a new light into policy analysis and the question of public choice, because it enriches this repertoire. Now, for us here at the Harvard School of Public Health, I think this is a very, very important initiative, because the whole idea of public health is to advance knowledge and then translate knowledge into evidence that guides decision making. But one of the things we always study in public health is this knowledge action gap, the implementation failure. Not the problems that are there in the world because we don't know, but those problems where we know, but we fail to act on that knowledge. And that's, the 7 million deaths of children under 5, still, most of them, the vast majority of them, totally preventable. The 2 women who die, or the women who die every 2 minutes, the woman who dies every 2 minutes in childbirth or in labor, again, 99% of those are preventable. It's those gaps where we know what to do, but we fail to act on that knowledge, that I think pose probably the strongest ethical imperative in terms of any human rights framework. It is true, that we've actually acted. So the number of preventable deaths in children under 5 was 11 million just a few years ago. And thanks to the Millennium Development Goals, they have been brought down to 7. But those 7, given that they are also preventable, just speak very loudly about the failure to act. And what I think this initiative contributes is a formal way of measuring that cost and then helping decision makers to take that also into account. And I think if we are to close that gap between what we know and what we do, which is, by the way, the purpose of the forum. This forum that we're all participating in is exactly to try to bring those who generate knowledge together with those who use that knowledge to make decisions. And we actually have here the 3 ingredients represented in my fellow panelists. You have, a very distinguished academic, Professor Sudhir Anand. We have the minister, Tim, who is a decision maker. And we have Albina as an inspirational leader who has this insight out of her action on the ground, and then uses that knowledge that gets created in the actual experience to gain that insight and then catalyze this dialogue. So this is why this is so important, because it's exactly this kind of dialogue that we require if we are going to deal with the failure to act.
Thank you. We are now going to take, we're going to have a brief period and take 2 questions from the audience. Please wait for the mic and we'll take your questions.
Yes, thank you. My name is Jennifer Leaning from the FXB Center, and I have a question for Professor Anand. In the elaboration of costs, and Minister Tahani referred to this, but I think it's a really interesting aspect of the study. You departed from the usual way of looking at cost-benefit analysis by not monetizing everything. And could you describe the background to that decision and what it really means for those of us who are looking at it as a decision-making approach?
You want me?
Yes.
Sure. Thank you. That's a very good question. In a sense, but only in a very limited sense, this is the cost of inaction, and its evaluation could be thought of as a full-blooded, comprehensive cost-benefit analysis. But its starting point, there are many, many differences, and I will try to address Jennifer's question. There are many differences. First of all, the starting point is different. In standard benefit cost analysis, you have a project, you calculate the costs over, for example, you may have a factory which makes ball bearings. You have to buy in the steel, the labor, the electricity, you make ball bearings, it's done over time. The ball bearings sell, you have to make a prediction of how much the ball bearings are going to sell for. The benefits are certainly all monetary in this case. I'm deliberately choosing a very limited type of project, but the benefits are monetary. You can sell you make predictions of what the price will be, what the cost will be over time. You calculate the net present value at a rate of interest, rate of discount, or you calculate the internal rate of return of the project, and it turns out to be 10% in monetary terms. So all the inputs and outputs are valued in monetary terms. Now that is standard benefit cost analysis. Here, the starting point is not a specific project, it's an area. The area is, in the case of Albina's description of it, a whole discarded generation. So we focused in this book on children affected by AIDS and poverty, and identified priority areas that could address the negative consequences of children who are suffering in this respect, and their lives. So it was a process. The process is a dynamic one as opposed to a static one. You start with an intervention, say, aha, now we need to actually, for example, early childhood development, we need to construct maybe a building or have people go out to homes to provide some information or support for mothers and parents who are trying to get preschool children adequately supported for later, school. Then, but they are, then they're going to go to primary school. You need a primary school. You need to train teachers. You need to build a school, train teachers, etc. Okay, so there is a kind of a iterative process which was conducted in coming up with each of these interventions. Now, the interventions themselves, we call them constitutive and consequential benefits of an intervention. The constitutive benefits of a health intervention is improving the health of the population that is being covered by this intervention. The consequential benefits are perhaps improving the educational outcomes, because once they're in better health, they're likely to attend school, they're likely to learn better, and so on and so on. Okay? So those are the consequential benefits of an intervention as opposed to the constitutive benefits. These you could think of in purely economic terms as externalities. Yeah? In other words, positive externalities from an intervention. By the way, if you had an education intervention, it might have health benefits. An education intervention has clearly economic benefits in terms of increasing economic productivity, the earnings of the children who, or secondary school people who receive an education, and economists typically calculate the rate of return to an extra year's education, but leave it at that. Okay? There are many, many consequential benefits of an educational project which are not quantifiable, incidentally, and we want to list them. We want to list them and present them so that in making a decision about, say, an educational project, the decision maker has the full set or vector of benefits, which some of which are quantifiable, some are not, some are quantified in monetary terms, some are quantified in health terms like lives saved or illness avoided and so on, yeah, which are very hard to reduce to monetary values, which is what benefit cost, or at least standard benefit cost analysis requires you to do, to reduce benefits in multiple dimensions using often dubious methods like valuing lives, the money value of life. Fortunately, we are at the School of Public Health and we don't do that at all here, yeah? Put money value on lives. But in economics departments and maybe in finance departments, they do. Yeah, that's their methodology. We don't. We just say that these are the health benefits and here they are. We list them. Morbidity avoided or reduced, mortality reductions, life saved, and so on. So benefits occur in multiple dimensions. In this book, we are looking at benefits in three primary dimensions, namely health, education, and income.
Professor Anand, it sounds like the approach, though, is trying to bridge, is trying to create a bridge between the public health approach and finance ministries, among others. I mean, can we maybe from our current and former politicians, if you could address this issue, because my understanding is that one of the biggest problems to implementation of public health and education and things that that those ministries might themselves think are good, when you come up against the finance ministry and you come up with actually spending the money, is where you often run into problems.
Did you want to?
Yeah, Minister,
I just wanted to intervene because what Minister said before about giving the antiretroviral so much needed to children. But in the case of AIDS orphans, there's nobody to go and take care of them. So that's why the program that we made enables the families to become economically independent, to get out of the deep poverty, so that they can access what is needed, the health care, pay the school fees, etc., etc. And that is why we transformed the public health paradigm of Dr. Jonathan Mann, the inextricable, as I call it, indispensable link between health and human rights, by adding, to make it a development paradigm, the income-generating activity. And through that income-generating activity and all the processes that go for 3 years of the program, the families come from being underneath the level of poverty, very much underneath, as Professor Anand saw them when he went, to becoming people who have little businesses, are making money, and can give access to their children to everything they need to become these productive adults and citizens in the future. So the economic is crucial. You can't just do one. I mean, I think our program is a holistic approach to the economic and human development, and that is what is needed to raise children. And investing is not that it's cost effective. It's not that really expensive when you think of the results. And investing in children and youth is investing in the world's peace and security. So I think it's very important.
I think, Sam,
Thank you, Sudhir.
the most important thing to note is that in policy analysis, you can focus on discrete projects or whatever, or you can focus on a program, the totality of that program. And some of the successes you have within the program would probably trigger or have other consequential effects. And so what Albina is saying is, look, we are here as a society and we want a better life. So I'm defining the goal in a much broader context. What will constitute a better life? It's a people that are well, able to work, and it's a people that are intellectually bright and able to create value and other means. And it's a society that through research and development is going to do this and that and that. And consequently, the development of the less developed countries will be better. But where do you start? If I take just discrete projects and keep on investing in this one, investing in that one, I may never see the total impact. And as a holistic way of looking at it, yes, it's a starting point, but there are consequences that over time may enrich what started as direct, immediate benefit. I think in economics, although I'm a good defunct economist now, but as an economist, this dynamic over time, we tend to gloss over it in development, and the methodology and coupled with the holistic vision of it says, be aware that you provide this investment in this child and empower that child. You are in fact creating a platform for that community or that society in 10, 15, 20 years' time to be better than it would have otherwise been. I think that's the way I come out it. Now, how we make decisions publicly, sometimes it's on the basis of emotions, but we take only the direct primary cost and say, if I can have 30 children alive, I'll have done something. But that will also require investment in schools, in housing, in other matters as well, to maximize the benefits.
Is it normal to be thinking that far ahead, 10, 15 years, when you're making policy decisions? My understanding was the farthest window was 5 years for a politician, and beyond that, they didn't care anymore, because it's someone else's regime.
Well, yes, politicians do tend to think that way, but there are some professionals also who happen to be thrown into that environment of decision making. And so you have a model that you work on for over time, and you are aware that decisions you take today will have far-reaching consequences on the type of society you want to have.
I have to say that not every Minister of Finance is as enlightened as Tim Thahani. And there tend to be much more, that's why he's been, has had an enduring presence in not just in Lesotho, but all over Africa and the world. But, when I served as Minister of Health, I did find that the single most important competency of a Minister of Health is to learn how to talk to the Minister of Finance. And I also found that other than present company accepted, most ministers of finance are not moved by moral persuasion. It's good evidence that matters, and that's where this book is so important, because we keep saying in public health, prevention is our main value, and when there are events, as Sudhir was saying, that we cannot fully prevent, like an earthquake or a hurricane, then preparedness, right? Those are the three P's of public health are prevention, preparedness, and then protection. We are able to protect when we prevent, when we act before something happens, or when we prepare in case something happens. But a problem we have is we are often selling the absence of an outcome. And for most politicians, it's very hard to persuade them to spend money on something that's not going to happen. And I think this is where this approach can provide an analytical tool to actually say, if you fail to act on time, it's not costless. This is everything bad that's going to happen. I think this is the value. It empowers that dialogue with the finance minister and encourages a longer term perspective.
In a sense, picking up, I think all of the panelists really agree on this. Albina had put it that there are downstream costs if you don't act. And these, if you point out what the costs will be, will have to be picked up by and will be part of what the finance ministry has to cough up if they're going to rectify the costs. Albina particularly was interested in, at some stage is interested, she said, well, the discarded generation, they might go into drugs, become child soldiers, into prostitution, into crime,
raised, yes,
and so on. These all are economic costs which the finance minister will eventually have to pick up. Yeah.
Right.
AIDS, if that increases, etc. Yeah.
So let's take some questions from our studio audience, and also we've got our online audience as well is going to have some questions, I think. So should we start with one of those online, or? Oh, okay, we'll do a studio first.
Hi, ELISA Heyman from the FXB Center for Human Rights. I have a question following on this last round of comments about the political costs of inaction. I lead a study very much inspired by this book on the costs of inaction on maternal mortality in Eastern and Southern Africa, and considering more fully what happens to children and communities when actions are not taken on maternal mortality. But one of the things we have found, especially with relation to orphans and vulnerable children programs, which are incredibly underfunded. I mean, in Tanzania, the Department of Social Welfare gets less than 1% of the Ministry of Health budget, and they're really entirely dependent on donor financing. And one of the things that has been brought to our attention repeatedly is that the downstream effects, let's say, don't get the same kind of don't bring the same kinds of political costs as if they run out of ARVs in health centers. If there are stockouts of some other essential medicine or some other program, so that the government fails to prioritize those orphans and vulnerable children programs precisely because they don't face the same political costs. And I was wondering really if any of the panelists, but especially Minister Tirane and Albina, had any views about how to kind of change that calculus on the part of governments. Thanks.
I think the problem is what are the political costs? Specifying what those political costs are. My not being elected again. You see, up to now, the value of the concept is to raising a social awareness in terms of thinking, of considering the problems in a holistic way. And as Professor Anand said, you don't act, but it doesn't mean that there will be no consequences. The alternatives will continue to go. And so even if I avoided or taking a decision today, I am deciding. And the results may come in 3 years, I lose the election, or 5 years, I lose the election. But the consequences, the secondary consequences will be with us and with that country for a long time. And it is, I think, you people and the media and everybody to raise an awareness that refusing to act in a particular way is in effect taking a decision of the direction in which that society will go.
I think a very concrete example, for instance, is what our conversation was, Julio, before we came in here. Talking, for instance, about the drug dealing. I mean, that's a political consequence of instability for the country in the future. So if you're going to be raising children properly, and if their families are going to be economically empowered, and those children, as Professor Sen says, are going to break this vicious circle of poverty because they will be out of it, so their children will be out of it, they won't have to resort, in the case of children who are, especially the orphans, or the children who are abandoned from broken families, they won't have to resort to go into the drug dealing cohorts because they will have a life. Why do all those children fall into all those ills? Because they don't have anybody to raise them. They don't have anybody to feed them to start with. They all need father figures. The child soldiers are desperately loving their commanders who make them do atrocious things because they need to have some structure. So that's why I'm advocating so much that children need to be raised for the future of the political country. And you're right to say that usually the governments do not think they will be re-elected if they address problems. However, my last remark is that a wonderful minister in Rwanda, who is Minister Jeanne d'Arc, said to us, oh, and it's a small country, Rwanda, I wish I could put the program of FXB Village Models into all the poverty places of Rwanda, because then we would eliminate poverty in our country and our children would become productive citizens with life skills and possibility of making living and raising their own kids.
We have more questions from our online community?
Yes, we have a number of questions that have come through on email. So let's see, this one is the first one. The studies in Rwanda and Angola focused on children affected by extreme poverty and HIV/AIDS. Can you talk about what you learned about the long-term effects of lack of education in particular on these children?
Well, that's exactly what I was saying. Yes. The lack of education, they can't make a living. They have to resort to live to all these ills that people, grown-ups, pull them into.
And was there any other thing in that area that you wanted to elaborate on? I think that may be where this question is coming from.
I think if one takes the HIV and AIDS and orphans and so on, you have to look at it over time. What kind of society you are going to have and build. In Lesotho, we started with the campaign, Know Your Status, so that you can receive treatment, so that you can be helped. For the children, they cannot go by themselves, they depend on me to do that. So it was a lot, it had a lot to do with directing the message at the parents to help the under 5 so that you can catch them on the transmission from mother to child. But if they are already born, you have a problem unless the parents actually take over. So that the question that is being said, there are other investments we had to make. So we had to make the investment in the clinics and so on for all support infrastructure. And you had to make this investment in education. When they get to 6, they have to go to school. You have to make a lot of other investment before you can see the results. If you simply address it at a point in time, you will get the direct benefits. The child will be well. But if the environment, the infrastructure is not there, sustainability, I think, is the key.
Minister Donna, can I ask you to follow on that? One of the key factors in public health is water and sanitation, and now this is now your purview. These are big. These are expensive upfront costs, and they're very hard to get through. A lot of people, countries often end up and the interventions that end up happening often end up being you know, at the home level rather than the big the big state projects that are going to you know, make a difference sort of long term and in a much broader way. How do you convince your government, your ministry, to get that stuff through?
Well, the first point is I was in finance for 10 years, and I was a bit unkind to my predecessor in energy and water affairs, because you just had to cut. But ultimately, thinking, if you don't have water, life is gone. Forget about it. So having that water sustainably, conserving it, managing it, has become very important. So for me now, the argument is not to look at the investment per se, which is very large because we have to build a dam and so on, but to say that the benefit from that is not the contractors or whatever the money you get, but the life in the stream of benefits, the life that will be made possible by that water. And when you deal with energy, you'd also say you need that electricity for cooking the food. Otherwise, you have a problem. So these are interrelated facts. And I make the point now by simply saying, look, if you don't give me money, watch out.
But why can we provide exactly what you're saying on a tiny level of 80 families and several units of 80 families, bring them water, getting to get the, how do you say, the source, how do you say that, the water, how do you say
the sewerage?
No, the source, where the water comes from.
The wells, yeah.
Capturing the springs, making water conservation, so, and accessing food by making them grow that food, as adding special initiatives now like biochar that exist that make your harvest 5 times better than before. Why can we, as an NGO, with the money from outside, manage to do that, and governments can't? I think, Minister, if I may say, it's because you look from the top down instead of looking from the bottom up. Maybe you should do small projects instead of being a big dam. Maybe you should try to capture the springs and do water conservation.
1 minute to answer that in one. We would love to, but I can't do everything
alone. Somebody, I agree. That's where you have
somebody has to look at where this country will be in 10, 15 years from now.
It will be better.
But
with that.
You have to, each one of us, volunteerism comes in there, now have to do our part from the bottom.
Absolutely. So we have to join hands.
So let's get some more questions from our audience, please. Sir? Wait for the mic, please. And if, just in the interest of time, perhaps if one of you, perhaps two, could answer, and then we'll move on to the next.
David Arand, Health Policy and Management. I have a concern that I appreciate what you've written and what you've shared today, but as a non-economist, the fundamental law that there's a limited resources, there's a, and that some of the thinking and decision making in a poorer country regards, a cap on ultimate resource. You might identify all the needs and the consequences 15 years down the line, but sort of as you were alluding to, there's only so much money and you have to make choices. And it seems to me one of the questions that morally, since you raised the ethical questions, that we need to, and I'd like to hear what you think about this, we need to address as a global society is that we have very rich nations, very rich people. I'm American, I'm one of them, and we have very, very poor people. And how can we ethically, we go to churches and synagogues and mosques and Hindu temples and on and on and on, but how can we change the real deep ability for everybody as a world society to give something up and to share, because it seems to me without that we're going to be in the same rut over and over again, despite the wonderful comments you've all made.
Can I just add, while you're giving back the mic, that you're absolutely right. And 25 years ago, how did I fund our NGO? I gave away 3/4 of what I owned at the time. And I think that it's corporate social responsibility enterprises should also give big chunks, and people who have the money should give big chunks. But there has to be a general policy, because if you go and do a little hospital there, a school there, a spring here, it's not going to work. It has to be, that's why I believe deeply in this holistic approach. And you have to empower economically the people, otherwise it's just going to not be sustainable.
Okay. Did you have a question, sir?
Hi, I'm Daniel Erim from the Center for Health Decision Science. Shouldn't this narrative include children who die as a result of untreated maternal complications that could have been prevented?
Yeah, about 40% of the 7 million globally are neonatal deaths. So we're talking more than 2.5 million. And that's where you know, the integrated approach that we're talking about becomes so crucial. You know, looking at the question of maternal mortality immediately takes you exactly to the problem of neonatal or perinatal mortality. But by the way, that doesn't include the stillbirths, so which you should also add into the equation. So absolutely, and this is one area, as Alicia was just saying, where we know what to do, because the proof is that, you know, if every 2 minutes a woman in the world dies in pregnancy and delivery, and 99% of those deaths happen in poor countries, I mean, that goes back to the question of equity, of global equity. It clearly means that, you know, there is the body of knowledge, and what we're missing is the will, not the resources, but the will to actually act on that knowledge and stop those deaths. I think, you know, what we are seeing, to put it on the positive side, is for the first time a global movement. I think exactly based on, you mentioned the concept of global society. I think we need to think of a global society, and the fundamental element of a global society is a framework of human rights. I mean, in the end, you know, this book is about a very, very brilliant insight, and it is about its illustration in practice to guide decision making. But along all the analytics we can have, we have to agree on an ethical framework, which I think, and this is, you know, what motivated Albina and at that time Jonathan Mann, the late Jonathan Mann, who was one of our great professors here at the Harvard School of Public Health, to found the FXB Center for Health and Human Rights. It is a question of human rights and embracing that ethical framework, so that, you know, avoiding those avoidable deaths, acting when we have the knowledge to act, is not a matter of charity. It's not subject to the economic capacity of people. It is actually the realization of a fundamental right. And, you know, I think the Millennium Development Goals are an expression of that vision, and a lot of progress has been made. Still a long way to go, but a lot of progress has been made based on this notion that these are fundamental rights of every person.
Dean Frank, could I follow up with you on that, though? Because out of that 7 million, those 7 million deaths, child deaths every year, 40% are neonatal, right? And despite, you mentioned in the beginning that there's been real progress made on reducing under 5 mortality. The one area where there has not been real progress made, that's been basically flat, as I understand it, is on these neonatal deaths.
Absolutely.
Why is that? There's clearly some fundamental, I guess it's an institutional barrier within governments dealing with it. I don't know. Can you?
You're absolutely right. When we look at the reduction from the 11 million to the 7, most of that progress is the post-neonatal after 1 month of life, where, you know, interventions like clean water become absolutely critical. But for the neonatal, it's all the preventive elements linked to the health of women. And if you ask me why, you know, the first thing is because, you know, this is one more reflection of women disempowerment and oppression of women, the fact that they are the most neglected, members of many societies, and their health needs, including their pregnancies, which is of course not everything that defines them, but it is a very important event in their lives, are simply not given the priority they need to have. The second is that this is an area where you need a functional health system to deal with the prevention of perinatal deaths, along with mortality deaths. You need a functional health system, and you need to strengthen that as well, which requires investments. I'd just like to add to what
Julia is saying, that if it's wonderful, we have to save the lives, but after we have to give them also a life.
Right, exactly.
Okay, thank you. So I think we have time for just one more question. We're running out of time. But before I take that, I just wanted to say we can continue, for those viewing online, you can continue this conversation at a www.forumhsph.edu. .com.edu? It'll say there, edu. Okay. So, one quick question and one concise answer. Does anybody got it? Okay, well then let's finish with the panel. Are there any concluding thoughts any of you would like to say about, specifically in terms of the practical implications of this? I mean, we just talked about the health system strengthening and why that's remains a really difficult thing to tackle, and this kind of long-term comprehensive approach seems to me to be getting at that. But can you share your thoughts?
I think the book is going to be a great proof because of its strong economic evidence analyzed by these professors for governments to take the right road of policy intervention in the future. I think it might, and I hope, influence policy decisions, such as the minister was saying, so that he can't be alone, but his other colleagues will also buy on the same principles.
I think what Julio said a few minutes ago is the most important thing. It is not just an intervention in isolation, but it's a whole system and the support infrastructure. For the women, for the under 5 or childhood mortality, the women having children away from clinics in an unsafe environment does account for a lot of the complications that could be prevented. But having that support of clinics or places where they can have children is also an investment, and it's a system. So the role of the government is to make sure the systems are there. And then the role of the individuals is to participate and interact with the government. So the book is going to contribute, I believe, in enhancing the dialogue between the actors, the politicians on the one hand, and the beneficiaries or the intended beneficiaries.
Thank you. Yes, please.
Very quick comment. I completely agreed with Julio and Minister about the health system and health system strengthening. But actually, the health system also interacts with other systems like the education system. And those interactions must be considered, not just the education system, water and sanitation, well, whether that's part of the health system or it's part of the infrastructure or whatever ministry it falls under. But these are all interrelated, and we have to look at it in those terms. We have to look at the requirements for better health, for better education, taking all these different types of systems, the health system, the education system, the water and sewage system, the sanitation, etc. Yeah? So that's, I think, if that is probably an important message, I guess, here.
And I would just conclude by saying, in the end, I think the book and the initiative on cost of inaction just illustrates the importance of evidence. Evidence literally means to make what's invisible visible. That's the origin of that word. And very often we fail to act because we think that not doing something becomes invisible. And what this approach allows us to say is to make that visible, provide the evidence that failure to act on that which we know will work is as Tim was saying, a decision in itself with long-term consequences. It's making the invisible visible.
Okay, that's a great way to end. Thank you very much for joining us. Thank you to our panelists.